So I am about to give you a nature prescription. Are you ready?
That was Dr. Razzani, a pediatrician who studied at the University of California in San Francisco and Harvard, discussing the healing power of nature and her ultimate mission to prescribe time in nature as a way to treat health conditions. Her extensive work in public health, her desire to preserve natural spaces, and raising her 3 children in an urban center has sparked her curiosity around using nature as a cure. In this presentation, I will be focusing on urbanization and how the inevitable increase of people living in urban environments has impacted mental health. Here is Gregory Bratman, a PhD student at Stanford, speaking on the issue.
There's been an alarming increase in the rate of urbanization that's happening throughout the world today. We recently passed the halfway mark where 50% of humanity live in urban areas. Projections are that by 2050, we're going to be at around 70% of humanity living in urban areas. Along with this is coming a decrease in the amount of nature exposure that people have and the degree to which they interact with natural environments. And then there's a third trend, which is there's an increase in anxiety and other mental health disorders, including depression, especially in urban areas.
This trend of increasing urbanization, along with increasing numbers of people experiencing mental illness, is ecologically, economically, and socially unsustainable. Regarding ecological unsustainability, less or no urban green space hinders the mitigation of pollution in cities and eliminates the positive impacts on both the environment and the citizens of natural ecosystem services. The rising cost of healthcare, and more specifically care and treatment for mental health disorders, is economically unsustainable for both developing and developed countries, considering one of the major reasons costs are climbing is due to the rising rates of chronic diseases. Socially, the rising rates of mental illness remains unsustainable due to the inability of society to function successfully, and for those living in urban centers to live out healthy and stable lives. My proposed solution revolves largely around increasing urban green spaces, namely parks and gardens, giving the general population who grow up in urban environments the opportunity to experience nature without having to go outside of their own community. To assess the association between psychiatric disorders and urbanization, the Netherlands Mental Health Survey and Incidence Study determined the prevalence of mental health disorders in a sample of over 7,000 people between the ages of 18 and 64. The sample was representative of the population as a whole. The study population was assigned to 5 urbanization categories, and the association between urbanization and prevalence rates of psychiatric disorders was studied over a 12-month period. The study was able to come to the conclusion that psychiatric disorders are more common and more complex in urbanized areas. They also insisted that the findings should be reflected in service allocation. As presented in HERD, the Health Environments Research and Design Journal, the environment is intrinsically related to mental health. The prefrontal cortex is more likely to be sensitive to the designed world, also known as urban settings, because they are deliberately intended to evoke human responses. Orientation to urban green spaces. An urban lifestyle survey was deployed in Brisbane, Australia in November of 2012 to assess patterns of green space use. About 60% of those surveyed had visited a park in the past week, and while this park user population had significantly greater nearby park coverage, a much stronger determinant of visitation was their higher nature orientation, suggesting that while both opportunity to go to a park and orientation to a park are important drivers for park visitation, nature orientation is the primary effect. Researchers from Aarhus University in Denmark found that growing up near vegetation is associated with up to 55% lower risk of mental health disorders in adulthood. Christine Eekman, the biologist who led the study, combined decades of satellite imagery with extensive health and demographic data of the Danish population to investigate the mental health effects of growing up near greenery. She says, green space seemed to have an association that was similar in strength to other known influences on mental health, like history of mental health disorders in the family or socioeconomic status. What's more, the effect of green space was dosage dependent. The more of one's childhood spent close to greenery, the lower risk of mental health problems in adulthood. Another study was pioneered in Serbia and was conducted in collaboration with the Faculty of Forestry, the Institute of Mental Health, and the Botanical Garden in Belgrade, in order to understand how spending time and performing horticultural therapy in specifically designed urban green environments can improve mental health. During the intervention period, the study group stayed in the botanical garden and participated in a special program of horticulture therapy. In order to exclude any possible special treatment or placebo effect, the control group was included in occupational art therapy, while it continued to receive conventional therapy as well. The results of this study indicated that the exposure to urban green space and involvement in the horticultural therapy program in the botanical garden had clear benefits for fundamental components of mental health, including a process of recovery from stress-related mental disorders. Researchers from this study indicated that nature-based therapy would be recommended to psychiatric patients as a form of occupational or supportive therapy. They also indicated that the study might contribute to addressing the need for interdisciplinary, integrated mental health promotion, prevention, and treatment of mental disorders. This next clip is of David Strayer, a professor of cognitive neuroscience at the University of Utah. He has been researching brain-based measures of cognitive restoration for the past 10 years.
Researchers who've identified and looked at what the benefits are of being in nature find improved short-term memory, enhanced working memory, better problem solving, greater creativity, lower levels of stress, and higher feelings of positive well-being.
The implementation of more urban green space, whether in the form of parks, gardens, forests, or even nature-mimicking art, should be supported because the evidence-based research on the association between urbanization and mental health disorders shows the innate need for nature within human-designed environments. Regarding ecological sustainability, increasing green space in urbanized environments will help mitigate pollution in city centers, as well as contributing natural ecosystem services that will have substantial positive impact on both the environment and the people living there. With a preventative approach, the cost for chronic disease treatment, including treatments for mental health disorders, will become more sustainable because the rates and therefore costs of these conditions will decrease. Concerning social sustainability, greater green space in urban areas and awareness around implementing time in nature as a mental health treatment will increase the overall health, well-being, and stability of society as a whole. In the future, more research should be conducted to assess the impact of prescribing nature in cooperation with other mental health treatments. In addition, changing policies in urban environments to require a specific amount of green space within a designated amount of land used for urban centers could have a substantial impact on the overall health and well-being of city dwellers.